Thank you, Guru. And I'd like to congratulate Dr. Chandy for giving us a wonderful presentation. See, firstly, we have to understand what is healthcare. Healthcare is not just building fancy hospitals. Healthcare is preventing people from going to the hospitals. And how do you prevent it? By giving them good, clean drinking water. If you give them clean drinking water, you can reduce 50% of India's cholera, typhoid, and all communicable diseases. By giving them good nutrition. If you give them good nutrition, you can bring up the immunity level more so that they don't get all these diseases. If you give them good environment, so that they're not affected by all these issues. Like GDP increases every year. But the catch here is, out of 6%, only 1% is from the government. 5% is from the individual. Compared to Germany, Germany invests 11.5% of its GDP in health. But the difference between Germany and India is, out of that, 88% is from the government of Germany. And for the rest, 12%, they have health insurance. So in Germany, not one individual spends out of his pocket for health. But in India, it's nearly about 80% of people spend out of their pocket for health. We can have fancy surveys which has been going on. It says that the highest reason for rural indebtedness is spending on health. It's not for farming or not for housing, not for education, not for anything, but health. So this is where we are far behind. And in fact, when I was the minister at the time, before I joined, the investment was about 0.8%, and then when I relinquished, it was about 1.2%, but still not enough. Today, we need a realistic, at least 3% of investment in health of the GDP, because he has also said in his slides that India's infant mortality rate today is about 40 per 1,000 live births. But Sri Lanka's IMR is about 8.5%. Bangladesh's is about 31. Nepal is about 40, equal to India. But then when you say India has become a smart India and all these fancy words you use, and India can become the fastest growing economy, all that. But you see, the last 3 years, the government of India has not invested more in health. In fact, in the last 2 years, the budget for the health sector has decreased. It's decreased. Can you imagine? So here, even though health is a state subject, coming to Tamil Nadu is also, the GSDP of Tamil Nadu is about 13.5 lakh crores. But then the investment of Tamil Nadu government in health again is about 1.3% of the GSDP. So we have, one side we have these parameters, on the other side we have fancy words of smart India. But again, we have to introspect, where is the problem? And today's topic, therein lies the answer. Is India investing in healthcare? Absolutely no. Absolutely no. And this is where we have to. I mean, everything in India, because India is 1/6 of the world's population. So when you take into numbers, say that India is diabetic capital of the world, tuberculosis capital of the world, heart disease capital of the world. Yes, it is, because sheer numbers. But again, India also has the other side also, flip side also. There have been success stories in India as well. Today, India has eradicated polio. Not eliminated, eradicated. India has not had a polio case for the last 5 years. It's a huge achievement done by India, where in a single day, 300 million children have been vaccinated in a single day. And 300 million is the total population of the United States. So this is sheer hard work of people as well. But then going back to the other issues about the mortality or the maternal mortality, coming back again to what Dr. Chandy has said that, yes, have we taken care of our mothers? No. Nearly about 150 women or mothers to be died during childbirth for about 100,000 deliveries. So it is shameful on us. Yes, I was a part of the structure. I tried my best to bring out changes. We launched a program called National Rural Health Mission. The program itself is called the National Rural Health Mission. And I'd like to say that 10 years from the program National Rural Health Mission, in the last decade, India has reduced its maternal mortality by 50%. Its infant mortality by 55%. Yes, I mean, it has never happened. And because of this program which we have launched in April 12, 2005. And today, I may say it's not enough, but then I could say that, yes, there have been resources pumped into the primary health centers, the sub-centers, the community health centers. But then on the other side also, we need personnel. Like Dr. Guru had said, like, we have about 9.5 lakh doctors, and these doctors are modern system medicine practicing doctors. But we need 18 lakh doctors. We need to double it. We have about 17 lakh nurses. We need 30 lakh nurses to take care of it. WHO's parameters for patient or not patient, people-doctor ratio is about 700 people for one doctor for 700 population. But unfortunately, we have about one doctor per 1,700 population. So we need to bring this gap, narrow this gap. We have about 460 medical colleges producing 63,000 doctors, not every year, but admitting them. But is it enough? No. There are 600 districts in India, and half of them don't have medical colleges. All these colleges are tied up in the urban sector. So we need to churn out that. Dr. Abraham is a nephrologist. And we all know that India again is a kidney disease capital of the world thanks to diabetes. And you know how many nephrologists are there in India? To take care of 1.25 billion population? Hardly about 5,000.
1,580.
1,580. I mean, earlier I thought it was about 2,500 about 4 years back, but so that is the sorry state of affairs. We produce about 60,000 doctors, but then we come to post-graduation. Nearly it's about 1/3 of post-graduation seats. So there are issues in that. Like we need to churn out more personnel to go into the rural areas. And out of 1,800 nephrologists, I'm sure 1,840 nephrologists, I'm sure 1,800 would be in only cities. And only 40 would be in the rural areas. And India is what? It's about 60–70% in the rural areas. When I was the minister, I brought in a program so that all the doctors should work in the rural area for 1 year. But then, again, there were all the other issues, and there were a lot of pressures, and then that issue was scuttled down. So, to bring about a change in India, I mean, it's next to impossible. So, that is again, because I was a part of the system, I knew I had to fight the system to bring about changes. To bring about changes in tobacco laws. You know which is the biggest killer in India? Alcohol. Second biggest killer in India? Tobacco. Third biggest killer? Non-communicable diseases. 18 lakh people die due to alcohol in India, directly and indirectly. 18 lakh people a year. 10 lakh people die due to tobacco in India. So you have 28 lakh people dying every year in India just by alcohol and tobacco. Why can't we do away with both of them? We have to fight the system. So we need to focus where is the problem and bring out solutions to that instead of beating around the bush. And to bring a change in India, I reiterate, it's completely next to impossible. So people also are oriented or disoriented, saying that why? Alcohol, no, it's my right to drink. Tobacco, it's my right to smoke. But then it's not the duty of the government to sell alcohol. Government has to give you free healthcare, free education, good roads, good water, good electricity, good housing, not to sell alcohol. Unfortunately, that's been done here in Tamil Nadu. Shameful. So when we address all these issues, then we can prevent people getting into these hospitals, going to these hospitals. That is what is needed. That change of mindset is needed. Invest in social sectors, invest in parameters, invest in education, invest in water, sanitation, nutrition. Unfortunately, the current government also is not doing this. Investing in our ITs, investing in smart India, cashless economy, all that. Put money into the sector. This is what is needed. Give them generic medicines, the exorbitant costs of medicines. Same medicine, Cipla manufactures medicine for 200 rupees. The same could be got for 8 rupees, the generic, the same quality. So this is what is needed to the people. And of course, health insurance. That is something which we have to take care of it. So, I mean, Guru, I think I'll stop there. I'll go on and on. There's a lot of, I could see some of sleepy faces out there, some of hungry also. And I can take some questions later on, So I'll just, once again, I'll just sum up, in the healthcare, India needs lots and tons of investments, like what has been done by the other developed countries like Germany or UK. We have a fantastic system called National Health Service, where 92% of the people take their issues to that public facilities. 92% of the people in UK are treated by public hospitals, much better than our Apollo hospitals in the UK. And we have a different model called Cuba. Cuba, it's a different concept of healthcare, where the government of Cuba takes care of all the healthcare, all the education, health education, plus the healthcare as well, where one doctor is being given for about 3,000 population. So the doctor visits the people. The people that don't visit the doctor visits the people, and then every year they do a checkup for a BP or anemia or diabetes, so that if they are found, they are treated then and there, not to let it pass diabetes to become a heart failure or a coronary issue, so future. So the concept of a preventive and a promotive healthcare is a need today. Thank you.